Good afternoon, everyone. At the outset, I want to thank organizer for inviting me here. So I'll be talking on the result of LUNAR trial, and this therapy is something unique and something new, and there are a lot of technical aspects. I'm not going into detail of that. So this therapy is tumor treating fields therapy in non-small cell lung cancer, and this was published this year in Lancet Journal. So, what is TTF or tumor treating fields therapy? Actually, it's application of electrical fields that disrupt processes critical for cancer cell survival and which leads to immunogenic cell death and enhanced anti-tumor immune response. In preclinical models, first they proved that these TTF fields actually amplified the effects of chemotherapy and immune checkpoint inhibitors. So there is a synergism between chemotherapy and IO and this tumor treating field therapy. So I'm not going into detail of the mechanism of action, but I must say honestly that there is still some clarity of mechanism of action is still a bit lacking. This is new treatment modality, and the strength of this modality is that this is non-invasive. So what actually is done? These are the electrodes. There are arrays of electrodes which are applied over skin on chest wall, and they deliver actually electrical fields around the thoracic tumor, and the recommendation is at least 18 hours per day it should be applied, and these electrodes are actually connected to a battery device which the patient carry with him. And presently, the FDA approved indications for this therapy is GBM as well as malignant pleural mesothelioma. And first, the pilot study was conducted, and that showed feasibility of TTF field therapy with pemetrexed in advanced non-small cell lung cancer. Now, coming to the present study, it is a phase 3 randomized open-label clinical study conducted at 130 sites and in 19 countries in North America, Europe, and Asia. What are the eligibility criteria? The patients were adult patients with histological or psychological confirmed diagnosis of non-small cell lung cancer. They were all platinum-resistant disease, that means they progressed on or after platinum-based systemic therapy. There was no eligibility restriction for biomarker status, and even in the result also they have not reported that what was the distribution of biomarker. And assessment of tumor PD-L1 status was not also mandated. Patients who progressed within 6 months of platinum adjuvant were included. PS0 to 2 with adequate hematological and organ functions were enrolled. Asymptomatic and stable central nervous system metastases were included. So these are the study arms. The patient, platinum resistant non-small cell lung cancer patients were randomized in 2 arms. The standard arm was physician's choice of therapy, which was docetaxel chemotherapy or immune checkpoint inhibitor, and intervention arm was physician choice of standard therapy plus TTF field. And so the TTF fields applied was 150 kilohertz was delivered continuously to the thoracic region. Recommendation was that at least 18 hours per day it should be applied. It was applied by Novo TTF device system manufactured by Novocure Switzerland, and this therapy using time every day and every month was actually captured in a device during this period. So the follow-ups were every 6 weekly, radiological scans were done, and adverse effects were monitored, and QL parameters were also recorded. So after progression, TTF fields therapy was permitted to continue if the provided the progression was outside the treatment fields. So the endpoints were primary endpoints were OS, and key secondary endpoints were OS in 2 subgroups, that is in chemotherapy subgroups and in IO subgroups. So total 276 patients were enrolled. and these are the characteristics of the patients. They are well matched, and one of the weakness of the study was that only 31%, roughly one third number of patients actually were exposed to IO, which is suboptimal as far as current standard is concerned. Most of the patients, 87% patients, they progressed after one line of systemic therapy. These are the results, very encouraging result. Overall survival in the intention to treat population was clinically significant. There was a 3 months OS benefit, and remember this is in second line therapy. And when you do subgroup analysis with IO, the TTF tumor treatment field therapy has prominent, more pronounced efficacy, because here the overall survival benefit in IO group patients is 8 months, 18 months versus 10.8 months. However, there was no clear statistically significant OS benefit in docetaxel treated patients, but the study was also not powered to capture that. Two important observations: there was no PFS difference, and there was overall response rates were also pretty similar. The overall response rate was 28 or 24%. So how to explain this, that overall response rates are equal, the PFS rates are almost same, and how the OS is doing so well? The authors, they actually address this issue, and they to them their conclusion was that most of the IO trials actually we observe the same result, that the PFS magnitude of benefit is not that great, but OS difference is clinically meaningful. What about the safety? There was no increased systemic toxicity because of TTF-free therapy. Only some skin-related adverse events were higher in that group, like dermatitis, pruritus, rash, and skin ulcer. But to remember, all of the skin rashes and dermatitis was because of the adhesive or actually the applicator, not because of the electric field itself. So the limitation, the major caveat is that the study design does not reflect the current standard of care. Only 30% patients were actually pre-treated with IO. Though significant OS benefit, neither overall response rate or nor PFS showed any improvement. And though non-invasive, however, the device is bulky, so QL data is not reported in this present article. So the key takeaways will be that overall, this is one of the randomized large trial LUNAR trial study, met its primary endpoint of overall survival, meaningful 3 months over OS benefit in second line therapy, and very encouraging 8 months increase in OS when the TTF field therapy is actually clubbed with immune checkpoint inhibitors, with no added systemic toxicity, and there was no new safety signals. Thank you.